It's the same old winter story. The drop in temperature during the colder months brings a rise in COVID cases, and this year is no different. Wastewater levels in Massachusetts have hit highs not seen since last winter's surge of the Omicron variant. That's thanks to a trio of immune-resistant subvariants, and one of them, known as XBB, accounted for just 11% of all COVID cases across New England just about a month ago. Well, now it's behind more than 3/4 of them. The rise of XBB as kids return from a lengthy holiday break has prompted Boston Public School officials to ask students and staff to wear face masks for 8 days after their return from vacation. This is in an effort to reduce the spread of not just COVID, but the flu and other respiratory illnesses like RSV. But it's a request, not a mandate. So is BPS doing enough to keep people safe? And what about the rest of us? So here with me now is Dr. Shira Doron, infectious disease physician and hospital epidemiologist at Tufts Medical Center, and Dr. David Hamer, a professor of global health and medicine at Boston University and interim director of the school's Center for Emerging Infectious Diseases Research and Policy. Welcome to you both.
Great to be with you.
So I want to talk about where we are in terms of COVID cases right now, especially around the city of Boston. Dr. Doron, why don't you talk to me a little bit about what you're seeing?
Yeah, we're seeing a bit of a confusing picture, to be honest with you. We see this really quite dramatic increase in the wastewater virus levels over the last few days or so. And yet we aren't really seeing that in the case numbers, either at the state level or in Boston. Boston's seeing an 18% decrease over the last week in cases. Hospitalizations are up a little bit, but when you look at where we are today, January 4th, compared to a year ago, January 4th, it's like a different COVID planet. I mean, we're talking about around 900 cases on a 7-day average in the state versus 23,000 a year ago. So things are a lot better, even though we're seeing this dramatic change in the wastewater at the moment.
Dr. Hamer, what do you make of these numbers recently?
I'm concerned by the rise in the wastewater data. And part of the challenge is there's a lot more people using home rapid tests. And those data don't feed into the numbers that the state has. In addition, a lot of universities and some schools a year ago were testing often with PCR or with rapid tests, and those data would feed into the state level data. And so that information is not reaching the state. So the state numbers, I think, unfortunately, are not as accurate as they used to be. But that said, I agree with Dr. Doron. There may just be a lot of people with milder infections. Hospitalizations have not changed very much. So that's good news. That means there are fewer people with severe disease. But the suggestion is that there's a lot of COVID circulating, and that XBB, 1.5 or whatever the current strain is, seems to have really taken off in New England and Massachusetts in the last few weeks.
Well, we know that BPS is saying that, it's not just COVID that's their concern. They're thinking about the flu. They're thinking about RSV, other illnesses. I know that Superintendent Skipper had cited, something like 60% of the flu cases in Boston are among 17-year-old folks and younger. And she also points to Black and brown communities. As we talk about that, is this mask mandate then necessary?
Well, the good news is that RSV is in the rearview mirror. That infection peaked weeks ago. We're seeing almost no positive tests at my hospital over the last several weeks. Influenza, we are hearing about high levels. We do have to recognize that we've changed the way we count influenza cases in a way that's going to make levels look higher. And so we look at influenza hospitalizations. It appears we're past the peak on that too. I'm not taking a sigh of relief yet because we had 2 peaks last year, but we are in a manageable flu season from a hospitalization standpoint right now in Massachusetts.
So then what do you think about this mask mandate?
Well, I think that...
Or, excuse me, recommendation. It's not a mandate, it's a recommendation.
Right. I think that it doesn't make a lot of sense to focus mask recommendations on schools and children when we aren't having those conversations more broadly about adults and all of the other venues within our state that are wide open and normal. And they're wide open and normal because we are in a very different stage of the pandemic with lots of immunity, access to testing, and access to treatment.
Dr. Hamer, what do you think about the mask recommendation here?
You know, I mean, I slightly defer in that I think that we're at a point. I mean, RSV is definitely dying down. Influenza has calmed down. COVID may be increasing, although it's not increasing in severity or impact on healthcare facilities. But there's still a lot of virus circulating, and influenza can affect young children, can make them quite ill. And in past years, if you shut down all the schools, which I don't recommend, but if you do that, then it often leads to an interruption in influenza transmission in a community. So, there's sort of movement of influenza into schools and then from the schools back to home. But I agree with Dr. Doron. If you're going to be doing a mask recommendation, it should be probably more widely implemented. And some universities, including Boston University, where I work, is having a stronger recommendation for mask use for the whole month of January as students return from all over the country, having been at events with families and friends, because the increased risk of transmission. And, the benefits are, if you get sick from influenza, I mean, you can actually be quite sick and you can lose many days, 3 to 5 days or more from work or from school. And that can really, have a negative impact on your education. But also if you have a child and your child gets sick and can't go to school, then the parents are going to have to worry about taking care of that child, and it may interrupt their usual schedule. So, there's some benefits to mask use that go beyond just simply preventing disease.
Well, there are families and there are some folks who say that this recommendation didn't go far enough. 8 days is not long enough. I want to pull up a statement from the Families for COVID Safety press release, and they say that the failure to institute true required universal masking after the holiday break follows neither the data nor the science. And there's a quote here from one of the parents, Suleika Soto, who says, quote, "This is an inequitable policy decision that leaves our children and the entire BPS community less protected in the midst of the current surge." I know, Dr. Doron, you don't think we need to go overboard with the masking, but when we're talking about disparate outcomes for Black and brown communities, do we need to have a little bit more caution here?
Well, I really believe that masks work. And before the CDC recommended making masks at home because that's all there was access to, and therefore recommended that everyone do it together because yours will protect me and mine will protect you, which was a message that was born of the fact that cloth masks don't work as well as medical masks. Before that, we knew that medical masks were used as personal protective equipment. And today, when the supply chain allows for people to use medical masks, and I believe that schools should be distributing free medical masks to those who want to wear them, we don't need to worry so much about what other people are doing because we each have the ability to protect ourselves with a well-fitting, high-quality medical grade mask. And I think that is a better strategy than relying on other people to reluctantly do so, who may then wear them incorrectly. They might not fit well, and they might not be good quality.
Well, Dr. Hamer, I know that the winter isn't over. Certainly it isn't in New England. It doesn't always follow the calendar. What should folks do, to your mind and the research that you've done, as we move forward through the winter months?
Yeah, I think it depends on the individual. And as Dr. Doron mentioned, it really is an individual decision. But I think that anybody who is, at high risk for developing severe disease, whether it be from influenza or from COVID-19, should be thinking about mask use to protect themselves, or if they have family members that are vulnerable, to protect those family members. And that goes beyond just schools and universities. It extends to the workplace, public transportation, And especially during the winter months when there's usually a higher risk because people are forced to be indoors. So I think continued sort of personal protection for those who perceive a need, whether it's their personal need or to protect family members, is a wise idea.
All right. Well, Dr. Shira Doron and Dr. David Hamer, thank you so much for taking some time with us.
My pleasure. Thank you for having us.